Hi everyone, I'm Dr. Gall, and I'd like to go over the three main ways to surgically lower a hairline. The first is to actually take hair, usually from somewhere in the back, whether it's through a strip, which means cutting away an actual sliver of the scalp, and then isolating the hair follicles one by one and implanting it, usually like right into the front right here, to effectively lower the hairline. The other way is not through a strip, it's to actually take little micro cuts, almost like punch excisions, and isolating the follicles that way, and again, implanting it into the front. The second way is to expand the scalp, usually with a balloon expander. It's a two-stage surgery where an incision is made in the front, a balloon is inserted into the scalp underneath it, and then slowly over time it expands through injection of saline into the balloon. And as that balloon expands, it stretches out the scalp, making it effectively a larger portion of skin. Once that skin is larger, a second stage surgery is to remove that balloon and then taking this bigger piece of scalp, draping it forward, cutting away the extra forehead skin and sewing it all back up. The third way is to make an incision at the hairline and moving the whole scalp, advancing it forward after elevating all the different attachments to the head, and moving the scalp, fixating it back down, cutting away the extra forehead skin, and sewing it all back up. Each one of these three techniques has its own pros and cons. There's no such thing as perfect surgery out there. You always need to be aware of the potential issues. For example, with hair grafting, even if it's done perfectly, it's almost impossible to get totally normal hair density, especially after only one treatment. Usually, even after 2-3 treatments, the density is still not quite right, especially with someone that has reasonably decent hair. The other issues is texture. Some people have pretty coarse hair back here, or at least a lot more coarse than their hair is up here, which tends to be a little finer and smoother. When taking this coarse hair and moving it to the front, there could be a textural difference in the feeling of the hair. Besides that, there could be little micro scars and other issues on the scalp. With a balloon expander, first of all, it's a two-stage surgery, which means you have to have 2 surgeries. The balloon is inserted, and then usually about 3 times a week or so, you either have to come into the clinic or you're able to learn how to do it yourself. A syringe is used to inject more saline into the balloon expander, slowly filling it up and expanding it. As that expands, it stretches the scalp. Once the surgeon feels the scalp is adequately stretched, the expander is taken out. Now, this process could sometimes take a few months. The other issue is as you expand the scalp, imagine the surface area is growing. Hence, the density of the scalp, the hair density, actually reduces. It only makes sense. The other issue is it also thins out the scalp just a bit. The second stage surgery, you go in, you take out that tissue expander, and then you have extra scalp because it's now been stretched out. It gets draped over, and then you make an incision, cut out the rest of the seemingly extra forehead skin, and sew it all back up. The downside is, again, the time. It's usually on the order of a few months. You end up with a scar right at the front of the hairline, which typically heals pretty well. It has potentially lower hair density on top of the head because now that scalp is a lot bigger than it was, and hence the hair follicles have been spread out. The last surgical option is a scalp advancement. And you make an incision, advance the whole scalp. What are the downsides with that? One, it's technically a lot harder than the previous 2 surgical options. 2 is you still end up with the scar right at the front, which takes some time to heal. The benefit is you're moving your native scalp with normal hair density, it all just moves down and forward. Yes, it could maybe tiny bit lift the hairline in the back, but honestly, that's a minor. With any of these surgeries, there's issues with potential scars, numbness on top of the head, with either the strip incision or the two other surgical options. I hope this gives you a rough idea of the surgical options, and stay tuned for more exact videos in detail for each one of these. Thank you.